Hi everyone, and welcome back to the MAPS educational series. My name is Chynna Smith, and I'm a fourth year medical student and a PCA, or primary care associate at OU HCOM, the Cleveland campus. Today I'm going to be going over a technique called Thoracic Inlet MFR, or Myofascial Release. So what is myofascial release? Myofascial release, by definition, is a hands-on technique applying gentle pressure to the myofascial connective tissue. And that's the white stuff that you see on the screen, here in between the skin layer and the muscle layer. It's kind of like saran wrap that holds our body together, our organs and our tissues. And when there are restrictions in the fascia, it can cause congestion or different materials in our body to build up. So what is the thoracic inlet? The anatomical term for it is the superior thoracic aperture. And why is this important? It's important because it's the primary location for lymphatic drainage. And lymph is a colorless fluid that runs along with our bloodstream, and it's responsible for carrying the tissues of our immune system. So it helps our bodies heal and regulate, and when lymph is blocked or our thoracic inlets are blocked, it can cause edema or swelling, and our lymph can't drain like it should. So when would you use this technique? You would use this technique anytime there was lymphatic congestion, because you want to make sure that that thoracic duct is open so that the lymph is draining. If there's any fascial tone asymmetry or things aren't comparing side to side, things like a common cold or other infections, anytime you want the body to heal itself, basically. And you don't want to do these things, obviously, if it's painful, if it's restricted in the area, if there's a fracture or something dislocated, if there's local malignancy or a local infection, you wouldn't want that cancer to spread or that infection to spread. So you want to be cautious there. And how exactly do you do it? So sometimes we call this the osteopathic steering wheel, like driving a bus. So you put your thumbs on the trap where the posterior rib is located, the index finger on your clavicle in the front, or where the first rib is in the front, the middle finger on the second rib, third finger on the third rib, and then you side bend, checking for motion. You can translate and move side to side this way. You can rotate clockwise, counterclockwise, and see which way the whole inlet would like to move. And then to treat it, you stack those barriers. So if it doesn't like to go side bend to the right, then you side bend it right. If it doesn't like to rotate to the left, then you rotate it to the left. If it doesn't like to translate to the left, you can hold it, and then you'll wait for a release, or feeling like the tissues are light or the fascia has let up, that those connective tissue layers have literally loosened. And then you reassess. And now I'm going to show you how. So as I said, you put your thumb on the posterior first rib, and then you put that index finger right where the clavicle is, and then you rest the other fingers, second rib, third rib. Now I'm going to check for range of motion. I'm going to push down and see if it goes inferior versus this side. And this side seems a little more stuck. I can translate it and see if it moves that way. I can go forward and back. And then I can rotate it clockwise, counterclockwise. To treat it, I'm now going to stack those. So I'm going to demonstrate how to stack in restriction. So it doesn't like to go this way, and then it doesn't like to go this way. Rotate it to the right. And I'm going to hold this here until I feel a release, or until I feel like the tissues are softer, or the tissues want to return back to neutral. This might take anywhere from 20 to 30 seconds. And I'll hold it. And then when I return back to neutral, I double check and see if it's moving easier, which it is. Thanks for watching.